fentanyl is a synthetic opioid. It's illicitly manufactured in other parts in in the United States and other parts of the country, and in Mexico and other places, China as well. It's found its way here in Connecticut. We had 1,524 drug overdose deaths in 2021. 86% of those drug overdose deaths were related to fentanyl. So it's a big problem here in Connecticut and in the Northeast, whereas other states throughout the U.S. Might have a little bit less. There's about 60% of the overdoses are related to fentanyl. So it's a big problem here in Connecticut and in the Northeast. But you know, it's getting into the drug supply. We have a very volatile drug supply here in Connecticut, and it's getting into cocaine, it's in heroin, we're seeing it in crack cocaine, we're seeing it with mixed with Xylazine, which is a veterinary tranquilizer. We're seeing more and more of that every year. Back in 2015, there was about 24% of the drug overdose deaths contained fentanyl. Now we're up to 86%. So it's definitely on the rise in the last 5 or 6, 7 years. So it's become a really big problem here in Connecticut, and it's extremely dangerous. You only need a small amount to be lethal. So we do encourage people with opioid use disorder who also use fentanyl to seek treatment, but in the meantime, if they're going to continue to use, they need to have certain things in place in order to use safely. And one of the things is to make sure that they have naloxone, that their friends and family have naloxone. Most of the overdoses actually happen in a residence, and there's usually in half of those cases, there could be a bystander who would be able to administer naloxone if they had known that that person was overdosing. So if they'd had naloxone and they knew that person was overdosing, that overdose could have been prevented. That death could have been prevented. So one of the things that we are saying to everybody here, like as a public health official, is that assume that the drugs that you get on the drug market have fentanyl. Test for fentanyl if you're able to do that with fentanyl testing strips. Make sure that you have people around you that can use naloxone if needed, and use any of those harm reduction methods that we've been really encouraging people to use, such as don't use alone, use when other people are with you, that they can have naloxone on hand and ready to use in the case of a drug overdose. So intervention is very important in order to prevent overdose death. So another thing that we're doing here at DPH is we've created it's called the NORA app, and you can get that off norasaves.com, and that will tell you what the signs and symptoms are of an overdose, so you'd be able to recognize an overdose, how to administer naloxone, where to get naloxone, what an opioid is, and how those can, how you can recognize that, especially if you have symptoms and signs of an overdose. We also want to let people know that in Connecticut we have opioid-related Good Samaritan laws that can, people who are on a drug overdose scene, who think that they might get in trouble, don't be afraid to call 911, because you are immune from criminal prosecution at the scene of an overdose if you are seeking, trying to address that overdose of someone that's with you, and you can call 911, you can give naloxone if you have it, but you would be protected from criminal prosecution. And then finally, the things that we're doing at DPH are really reaching out to the high-risk populations, such as people who have been recently released from correctional facilities, prison and jail, making sure that they are staying on their opioid use disorder treatment, their medication, making sure that they are being referred for care, and continuing with their treatment after being released from prison. We are making efforts in the syringe services programs for people who are injection drug users to provide naloxone training, as well as teaching them harm reduction methods, which is the ones I've talked about before. We're working with providers and training them in how to manage people's pain so that they don't overdo it and then become addicted to opioids. Another thing we're doing is working with Planned Parenthood, screening people at wellness visits for drug overdose, because it's very, for drug use, because it's very dangerous for pregnant women and women of childbearing age to be using drugs. As well as we just started working with our Office of EMS at DPH Really encouraging EMS providers to leave behind naloxone. There's some new protocols being put in place in Trumbull and East Lyme, Connecticut right now, just started within the last month, to leave behind naloxone at the scene of a non-fatal drug overdose. So those are just some of the points that I wanted to bring up today. I'm going to leave up to the next person to talk about the local perspective, especially in the Hartford area. Thank you.
Thanks.